Hi, my name is Kendall Lesser, and I'm the director of Miami University's Public Health program. Students who are considering the public health major often say to me, I know I'm interested in studying health, but what exactly is public health? Well, that's a very good question. Simply put, public health is the science of preventing disease and promoting health within populations. In public health, we study how rates of disease vary across different population groups, and then we propose large-scale solutions for solving these problems. Public health issues are issues that impact entire communities, not just individuals. Examples of public health issues include diabetes and obesity, infectious disease, infant mortality, sleep health, substance use, gun violence, emergency preparedness, and air pollution. The list of public health issues goes on and on. Public health is all around us, and we may not even realize it. Did you know that advocating for healthy policies, designing walkable neighborhoods, determining the cause of an outbreak, planning for emergencies and disasters, and ensuring access to safe food and clean drinking water are all examples of public health? Public health professionals often work behind the scenes to keep the communities where we live, work, and play safe and healthy. I asked some of our current public health majors to talk to me a little bit about public health. Let's hear what they have to say. Why are you a public health major?
I'm a public health major because I want to work with people and really affect the circumstances that they're in a real way. And the public health field is such a great opportunity to do that.
I'm a public health major because it's interesting to see how a lot of the diseases and sicknesses that people go through are how highly preventable they are.
Public health major came, I was able to do healthcare policy and administration, so it sort of tied in my two passions in life.
I'm a public health major because it shows me a holistic approach to health and helps me think bigger picture.
What does public health mean to you?
Public health is this art of promoting and protecting the health of people and their communities.
Public health is everything to me. Oftentimes public health is overlooked and we do a lot of the behind the scenes work.
So public health to me is an opportunity to better the health of people on a broader scale.
Public health to me means looking at health through a wider lens and knowing that health isn't only just personal, but how you can improve a whole community's health.
To me, public health is the protection of the emotional, physical, and mental well-being of a community.
What public health issue are you most concerned about?
I'm most concerned with the social determinants of health. I think it's fascinating that two people can have the same disease, but due to extenuating circumstances and social aspects, they can have completely two different outcomes.
I'm most concerned about the lack of preparedness in our national governments in the case of an emergency such as a widespread epidemic.
I am most concerned about health inequities.
Maternal mortality rates and infant mortality rates, specifically amongst African American women.
The influx of reported cases of childhood diabetes within our country, because I believe that with enough time and research invested, there's most certainly a solution.
And what have you enjoyed most so far as a public health major here at Miami?
I really like how public health has so many different classes you can take. I've taken classes in anthropology, I've taken classes in epidemiology. There's literally so many options that I feel like I've learned so much that I'm really prepared to go into the workforce.
I've enjoyed most getting to know my public health professors and advisors. I feel like they're always giving me resources and helping me to understand difficult topics in public health.
I really enjoy watching the field always grow and the fact that there's always something new happening.
Discovering and learning about all the different careers you can do within the public health field. You can be an epidemiologist, you can be an educator, you can work for organizations on a governmental level or just, a small community level.
Having the opportunity to study abroad in Lima, Peru, where we worked in mobile medical clinics alongside local public health advocates and doctors.
I would definitely say that the professors here at Miami have been by far just the best.
I've most enjoyed the variety in our classes because I feel like it reflects in the real world the multiple disciplines that are important to the field of public health.
Once you graduate with this degree, what are your future plans?
My plans are to go and get my master's in public health, specifically with a concentration in global health and health inequities.
After I graduate, I hope to pursue my passion of being a public health physician by first going after my MPH and then eventually my MD.
I would like to get my master's in public health, and the end goal would be to potentially be working for the CDC or have a position in the U.S. Public Health Service.
I plan to get a job somewhere in the public health field.
I have aspirations to work for the Centers for Disease Control and Prevention.
I want to pursue a career in medicine.
As you've heard from our students, here at Miami University, we've developed an interdisciplinary public health major, which allows students to explore the public health issues that they find to be the most interesting. In our public health program, students learn from our renowned faculty about how to create solutions to public health problems at the local, state, federal, and even global levels. If you're interested in learning more about our public health major, please reach out to me. I'm happy to answer any questions you may have about public health here at Miami University.